Signs of hope are emerging in some countries in Europe where they're starting to ease some of those tough restrictions. Several countries are reopening stores, businesses, and clothing shops, while others are restarting factories and construction zones. Now, Europe is trying to get its economy back on track as the coronavirus grips the entire world, and this comes as the International Monetary Fund warns the global economy will likely tank because of the pandemic.
For more on this, let's bring in CBS News correspondent Holly Williams. She's following the latest in Istanbul for us. So, Holly, what can you tell us about these new developments? Some of these European countries are feeling pretty confident that they can start easing restrictions. I note that Germany has already given some dates in May when they think that things could be back to semi-normal.
Right. So first of all, let's talk about what this is not. It's not about some pan-European decision to begin lifting restrictions. And it's not about any single country saying, right, that's it, we're done and dusted, everything's fine now, and it's going to be a free-for-all, we're going to reopen businesses and schools. Rather, it's individual countries making decisions to gradually lift restrictions based on their individual situations with the clear goal of trying to breathe some life into the economy, restore a degree of normalcy, while at the same time, trying to save lives. So, for instance, Austria yesterday allowed thousands of stores to reopen, but they had to be small stores. They had to be under about 4,500 feet. So they were allowed to reopen. Austria is a country that brought in social distancing measures very early and has had relatively few deaths. But then you have Italy and Spain, which, as you know, they're both countries that have been hit very hard. They are also gradually allowing some businesses to reopen. And then we have Denmark, which is reopening elementary schools this week, and Norway says that it will do the same later on this month. It's interesting to note that some of these countries have also announced plans to allow more businesses or institutions to reopen in the coming weeks, but they nearly always have caveats. So they will only do so, they say, if infection rates remain stable or drop off. For instance, Austria has said that if that's the case, it will allow restaurants to reopen in mid-May.
So, Holly, it's one thing to allow businesses to reopen, but you can't sort of legislate or mandate consumer confidence. And getting people to go out and go shopping, convincing them that it's safe is a whole other thing. I was just, right before we started talking to you, and I was taking a look at the script, reading about, clothing stores being open. I thought to myself, how comfortable would I be going to a clothing store and trying on clothes that perhaps other people had tried on before me? Can we talk a little bit about those concerns?
Right. So we actually spoke with Dr. Gabriel Lung yesterday. He is a world-renowned epidemiologist, expert in infectious disease. He's the one who's actually been advising the government in Hong Kong during this virus outbreak. And as you know, Hong Kong has been lauded for its response. And he said, a vaccine is 9 to 18 months away, perhaps. So he thinks what we'll see between now and the advent of a new vaccine is governments going through cycles of lifting restrictions to try and breathe some life into the economy, try and give people a degree of normalcy, and then reimposing those restrictions if infections spike. And he calls that suppress and lift. But he stressed you can only do that as a government. You can only kind of balance the economy and saving people's lives if you have really accurate data about infections, about how many people are being infected. And we know that a lot of countries are struggling with that, including the US. The other important thing to point out is that this lifting of restrictions in Europe has already run into some opposition. For instance, in Denmark, where they're allowing elementary school kids to go back to school beginning this week, there's an online petition that already has over 18,000 signatures on it, saying this shouldn't happen, it's unsafe, and children are being treated as guinea pigs. And we actually interviewed a father in Denmark yesterday who said, our children are being used as tributes. That's a Hunger Game reference. And what he meant was our children are being sacrificed by a government that cares more, in his view, about economics than it does about saving people's lives. So it's controversial.
Yeah, indeed. And Holly, let me ask you about what you're hearing, you're reporting on the coronavirus epicenter, which for quite some time was Italy, especially the hard-hit northern region. What are you hearing from that part of the country?
Yeah, I mean, very hard hit. More than 20,000 deaths in Italy, and that's a country of 60 million people. So, you know, Italy is one of the countries, though, that is beginning to reopen businesses, to lift some of these restrictions. This week, they've allowed bookshops, children's clothing stores and laundrettes, amongst other businesses, to reopen. But, once again, they've had pushback both from some of the business owners that say, we don't care if you're lifting restrictions, we're going to stay shut, and also from some local governments who say it's not time yet to start lifting restrictions.
You've done a lot of reporting on the migrant communities in Europe. How are they dealing with this coronavirus? Obviously, when there's a pandemic, the most vulnerable components of our society are usually hit the hardest. So I imagine it's pretty tough for migrants.
Right, so hundreds of thousands of migrants have poured into Europe over the last few years, most of them from the Middle East and from North Africa. And if you're a recently arrived migrant in Europe, you're more likely to be poor, you're more likely to not speak the local language, you're more likely to not know how to access services, you're more likely to be in poor health and perhaps have a compromised immune system. None of this is rocket science, as you point out, but I don't think this is just about Europe. I think one of the things that this virus has done is lay bare just how unequal our societies and the world is, and the people who are paying the highest price for this virus are the people who are at the bottom.
Indeed. Holly Williams, thank you so much.